Hi, everyone. Well, it's now 7 weeks, I believe, that we are self-isolating because of the COVID-19 virus. And I'm here in the state of New Jersey, which has the second highest amount of people that have been affected with the COVID-19 virus. And I felt that I needed to do my part to help. We know that there's a large portion of people that are carriers, and they don't even know that they're carriers. They're testing negative, or they may be testing positive and spreading the disease. And there's also a link between diabetes and cardiovascular disease and autoimmune diseases. And what I have been doing for my whole adult life is I've been working as a dental hygienist. And within the past few years, I became certified as a life and health and wellness coach. So I kind of wanted to tie everything together between the dental and the health and wellness. And I wanted to maybe share with you some tips on taking care of your oral hygiene, because I haven't really heard anyone discussing that as of yet. And I think that because the disease is spread through breathing and speaking and sneezing and coughing, and the virus comes into our bodies that way, and it is spread out of our bodies to other people that way, I think it's really important for us to all be taking really good care of our teeth and gums right now. And so I wanted to share some tips and techniques so that we can do a really good job taking care of our teeth. So the first thing that we usually do is we will brush our teeth. A lot of people use an electric toothbrush or a manual toothbrush. If you use a manual toothbrush, it's more limited as to how well you can clean your teeth with it. I know a lot of people do it because that's what they're used to, but ideally we're better off using an electric toothbrush because it just does a more superb job of cleaning. One particular toothbrush, I have a couple of them here. I have a Sonicare toothbrush and I have a Burst toothbrush. I'll just show you on this brush if you'd like. It's made of charcoal bristles, tapered, thin, soft bristles, and it has a few different settings on it. So it even has a setting for sensitivity. When your gums are sensitive or your teeth are sensitive to cold, it has a setting for that. It also has really soft bristles. So we'll be talking about that. I'm just going to demonstrate how to use that in a minute. The next thing that we can do actually after that is to use dental floss. And I just used it, so I apologize. I just want to get another piece. Dental floss. This particular one, I don't know if you can tell, but it's black. And it stretches. It has like a minty flavor to it as well. And there's another way that we can use the flosses with a holder. Makes it a little bit easier, especially for people that have bigger hands and have trouble getting their fingers into their mouth, or if they have problems with their dexterity. This would be great. And then we follow up usually with a mouth rinse. And then if you have it available, another great thing to use is a water pick. Right here. So we're going to go over some of these techniques now, okay? So the first thing we would do, if you're using a regular manual toothbrush, what you don't want to do is you don't want to scrub. People don't really know how to brush their teeth with a regular manual brush because we were taught when we were, for the most part, we were taught when we were 3 years old by our parents, and we didn't really know what we were doing, and then we just continued on with the rest of our lives. Scrubbing, maybe staying in one spot more than another. I know little kids like to do that. They'll find a favorite place in their mouth and they'll just keep brushing that spot, and the rest of their mouths are, forget about it. They never reach it. So what I would really recommend is using an electric toothbrush, and this is the way you would use it. You turn it on, you put a little bit of toothpaste on it, just not a glob because it'll just get all over the place. You just turn it on right here. And this particular brush has a 2-minute timer. Most of them do. I know that the Sonicare and the Oral-B also have a 2-minute timer. This particular brush also has a 30-second, 4 intervals of 30 seconds. So you would brush the outside of your teeth for 30, inside of the uppers, let's say, for 30, outside of the lowers for 30, inside of the lowers for 30. So all total, 2 minutes, okay? So we're just gonna take the brush. I'm gonna show you on my own mouth. You turn it on. You start in the back. And you just move the toothbrush. You just move the toothbrush and let the brush do all the work. You don't want to scrub because it's powerful. These brushes are rotating at like 30,000 revolutions per minute. You don't need to do anything more than guide it where you need it to go. So you want to make sure that you get every surface, outside, inside, on the lowers, outside, the other side, inside. And when you get to the lower bottom teeth, this is the area where most people get the tartar built up. You want to take your brush, put it in this way, like that. And then you can get each tooth individually. If you use a bigger brush or let's say the Oral-B brush, which a lot of people like this brush as well, but when you get down to the lower inside of the lower bottom teeth, this brush really doesn't get to that area very well, just from experience. So I would use one of the other brushes that's more of like a regular toothbrush shape. I think it just does a better job in getting in all of the nooks and crannies. Next, dental floss. The F word, floss. People hate it. But it really is good. And once you get used to using it, then it's really, really, really helpful. And I'm going to show you how to hold it, because most people, from what I've observed as well, do not hold the floss correctly. So we're going to take the floss, and instead of wrapping it around your index fingers, you're going to wrap it around your middle fingers. You leave a piece that's about this wide, so you can make like a picture frame around your face with it. If it's too wide, you lose control. If you get a little closer, you have more control. Then you want to take, let's say if you're doing your upper top teeth, you want to take one finger on the inside, one finger on the outside, like that. I don't know if you could see. And you go up and down, and then you flip it around. Go to the tooth right next to it, and then you wipe it off so you don't take the plaque and the food from one section and then bring it to the next spot. So after you use it, you just wipe it off and go to the next. Very simple, okay? You start at one end of your mouth and you work your way around, then go to the bottoms, work your way around. Don't just stay in the front. Don't just stay in the back. If you happen to go in the back and you're afraid you're going to get stuck with the floss, you could always let go of one piece and pull it through like this. Okay? Then you get it out. You'll never get it stuck that way. Another way that you can do it is with a holder. It has the floss already in there. They're disposable. You use one, use it, and then toss it out. You go in. Again, you want to go up and down. You don't want to saw it like you're sawing on a piece of wood, because you're going to be irritating your gums. You want to go up and down gently. After you use the floss, you want to rinse with a mouthwash, spit it out. Don't rinse it with water afterwards, because usually you want it, like this particular one has fluoride in it. You don't need to get one with fluoride, but you don't want to really rinse with it. Also, if you have a water pick, it's a great tool to use as well, because even after we floss, there's still plaque and food that's loosened up that hasn't really come out. It looks like you're getting everything out with the floss, but you're not. It's loosening it. So you want to get in there and rinse everything out. So you could fill the water pick up with either like a little bit of salt water, or you can put some mouthwash in there with water to dilute it a little bit so it's not so strong and it doesn't clog up the insides of the water pick. You just turn it on. This particular water pick came with like maybe 5 or 6 different shapes. I chose this one. You just turn it on, and then you just go around. I think it's not plugged in, sorry. I disconnected it. So you just go around and you go perpendicular to the gum, You don't want to shove it up into the gum. You just want to put it against your tooth and go around. And that's it. If you have, the water pick is also a great tool to use if you have bridge, if you're missing a tooth and you have two teeth that are holding the fake tooth in between. A lot of times food may get stuck under there. The water pick is great to rinse it out. Also, if you have implants, sometimes there's a little bit of space between the two teeth because the bone is missing. So the water pick is also great to get in there and clean out any food. You don't, even though it's not your own tooth, the implant is in the bone, and it can still get bacteria from your mouth, and we don't want that bacteria to spread throughout the mouth and the other teeth and also around the implant itself. So using a water pick is really great to clean. So that's it. This is what we don't want to happen. We don't want the teeth to build up with tartar like this or like this, because you could see all of the inflammation around the gums. That's not how we want it. We want it to be nice and pink like that. Okay, so thanks for tuning in. If you are interested, by the way, in this brush, the Burst brush, you can buy it online or through a dental professional. If you buy it online, if you go to their website, it's burstoralcare.com. And if you use my promo code, it's a professional code, they will give you, I believe it's about $30 off of the brush. They also have whitening strips, they have floss, they have gift packs for Mother's Day and all this. So you can use this code and that will help to get you a discount. Also, please, I just encourage you to get some sleep, keep hydrated, eat healthy, get outside, get some fresh air, walk around a little bit in your own neck of the woods, staying away from everybody, keep your mask on. And if you have any comments or if you'd like to reach out to me, please do it here on YouTube. You can also reach me on Facebook. My Facebook name is Elyse Zinger, Zinger. Like I said, I'm a dental hygienist. I'm also a health coach and a life coach, so I'd love to hear from you. Please stay safe, stay healthy, and keep your mouth healthy, okay? Take care. It was great speaking to you. Bye-bye.